Hi everyone, this is Ivan from Imitated Environments, and I'm just going to quickly show you through some of our new hospital pharmacy features in Pharmacy Simulator. So those of you who have been with us for a while are pretty familiar with how things work in the community setting. Hospital setting is very similar, but obviously there are a few differences. So we load scenarios as normal by going to the load scenario menu. We can see we've got a new drop down here for the role, where we can set the player's role and filter based on that. I'm just going to load a simple hospital scenario here. Here we've spawned in the nurses station.
Hi, can I ask you to come help with this new patient? Acute pulmonary embolism. I wanted to get his medication plan started ASAP.
And we've been approached by a doctor who has a query for us. So a lot of hospital-based scenarios are going to look a bit like this. Before we continue, I'll just show you around the hospital a little bit so you can get a feel for it. I'm using the simple control scheme here, so as before we have this navigation button and we can click to where we want to go. The doctor's following us because he's currently set to be trying to talk to us. Over here we've got patient beds, and we can see there's a patient in there and a nurse. And over here we have the impressed cupboard, where we can pick up normal on the ward medications and supplies. And in the nurses station here we have the telephone, receptionist or nurse or whoever the scenario author wants to put there, and we can use this dispensing computer to search for products and dispense them as normal in the community pharmacy setting. Obviously this will probably change a bit as we develop the hospital features a bit more, but for now we can use this to order medications and the robot will fetch them. Over here we have the patient charts, so the bed 1 there, bed 2 next to it. We can see this one's labelled Mr. S patient chart. If we talk to our doctor again.
Let's go visit Mr. S in room 1. I want to get him under control ASAP, so I'd like to get his medication plan at least started right away.
Alright, so he wants to go and check out Mr. S in room 1. So I'm going to grab Mr. S's patient chart here. Now I can click on this and I can review the chart straight here. This is great. I can see his history, I can see what medications he's got charted, I can see lab results, and I can see imagery. So we can see some pulmonary embolism there. But it may be useful to pick this chart up and then it will go into your inventory here. If you're playing with the more advanced gamer control scheme, you would press I to access the inventory. And we can see we've got the patient chart here, which we can review from our inventory whenever we like. Alright, so I'm going to follow him into the patient's room now and just sort of insert myself in here. We've got a patient who, he's got some animation going there that shows he's in a bit of distress, maybe having trouble breathing. So what does the doctor
This is
want to
Mr.
do?
S. He's got pulmonary embolism and a few other considerations. I really just want to get therapy started ASAP, but want your views on the best line of treatment and dosage.
Alright, so he's the doctor's essentially asked us to get a medication plan started. We don't at this time have a procedure for drawing up what we would consider a typical medication management plan, which would normally be like a charted form that you would fill out, because we don't have any way for the student to enter that and then automatically assess that what they've entered is correct. So instead, we are, at this point, we are simulating this by having conversations with other healthcare professionals. So particularly the doctor here, he has questions about the medication plan for this patient. He wants you to do a quick review and give him key considerations to get things going. And this is a pretty reasonable approximation. Obviously in the future we do intend to have a more formal medication management plan process for the students to go through. But this is a step in the right direction. So I'm just going to raise the bed here because that patient seems to be having trouble breathing.
Oh, thanks. That seems to help a little.
Okay. Now, over here we've got a nurse that we can talk to. Some scenarios will have a nurse, some won't. We have a hand washing station. We can engage in hand hygiene. And we have the abridged version of the chart at the end of the bed here. So I can review this one, but it only shows history and medications. That's how things tend to go in Australian hospital setting. Your mileage may vary. So I'm going to pop back over here and have a little quick conversation with the patient to get his medication history and get a better understanding of things. I can see from the chart that he had a checkup and had hypertensive urgency, but didn't get his prescriptions filled. Now he's got acute pulmonary embolism. We can see his height, weight, his oxygen's a bit low, and a few other things, diabetes, back pain. Cool. Alright, his medications, some of them not filled. Insulin, aspirin, that's interesting. And allergic to penicillin. Cool. Alright, and doesn't seem to be anything too interesting here at a glance. But I'm not a pharmacist, so you may have a different opinion. Alright, if we have a quick chat with him. So the student has an opportunity to be professional here. I'm Ivan the pharmacist. I understand you're probably uncomfortable. I'd like to figure out a few details.
Hi. Yes. It's hard to talk much, but I'll try.
I understand you have a heart condition. Do you know what medications you take to
I'm
treat
not
that?
too sure. Doctor gave me a couple new scripts for my heart the other week. But I felt a bit better, never filled them. Too expensive. I already told the nurse. It should be on my file.
Sure. Any other medications you take
Yes.
regularly?
I take aspirin 4 times every day. And my insulin, of course, and metformin, for sugars. Then there's like a Liso pill or something. And my bupe, not sure what they do.
Alright, so I'm going to take an opportunity to be a little bit empathetic.
Thanks.
The aspirin I was interested in because we need to start him on some anticoagulation, and that might be confounding.
I think 325 grams, need it for my back pain, gets me through work.
Okay, so aspirin for pain. Alright, I'm going to work with the doctor and we'll get you feeling a bit better.
Thanks.
Alright, so the doctor at this point is going to ask me what we should do, and I'm going to tell him we should get anticoagulation started right away. That makes sense.
Yes, I thought so. But which option do you recommend?
Now he's got a relevant question. The student has opportunities here to make some good choices or some bad choices. Like the obvious choice that a lot of students might make is to start on warfarin immediately, get that INR into a normal range. This is not appropriate first line, although it is the long-term plan. So we've got a few other options here for some intravenous and some oral medications. Quite a few of them seem fine.
That makes sense. What dose should we start with?
And then we have to do a dosing calculation. I've picked enoxaparin there because it's really easy. We saw that he was 120 kilograms before, so high dose.
Yeah, thanks. I really should remember that one. Is there anything else we need to sort out straight away?
And here he's asking us to identify probably the most significant potential drug-related problem. And we've got a few options here. Getting him to start his amlodipine, yeah. Statin therapy, yeah. Those are great, but the most important one here is this discontinuing aspirin, because he's going to be on anticoagulation. and he can use alternatives for his back pain.
Awesome, you're the best. Thanks for your time. I'll look forward to seeing the full management plan when it's ready.
No worries, I'll get to work on that.
Thanks, see ya.
Cool. And the scenario should end here. We'll get all the relevant feedback that we're used to getting in Pharmacy Simulator. I missed an opportunity here to talk to the nurse for a little bit of clarification. So I didn't quite perfect this, but we did pretty well. And we've got some useful feedback there. And there's a few sort of key learning opportunities for the students. So I'd say this is a pretty reasonable scenario. Alright, so hopefully that gives you an idea of how the hospital simulation tends to go. Obviously we'll be adding new features as we get along. This is a pretty new element to Pharmacy Simulator, so it's definitely a work in progress, but I hope you enjoy. Alright, bye.